Anybody else left? Okay, Anadunko, we will still start. It's already past 3:20. So AETCOM, there are different modules under AETCOM. For biochemistry, we have the module number 1.1. Come. We have certain learning objectives for this class, not only for this class, for these subsequent classes as well. We have the learning objective of understanding what professional qualities are of a doctor and the roles of a physician. The commitment to lifelong learning as a physician for our own growth, the understanding of the role of physician in healthcare system as a whole, and to discuss and identify the role of a physician in the society and the community that he or she serves. But today we are going to focus on the first one, professional qualities and role of a physician. Please understand and take these classes seriously because they come in your exams as well. So you can expect at least one AETCOM question in every one of your papers in every subject. All right? So this will go on throughout the course of MBBS. Anybody can stand up and tell me the full form of AETCOM? Very good. Attitude, ethics and communication. We have 5 modules in first year, 1.1 to 1.5. For biochemistry, we have only one module, 1.1. 2 are supposed to be taken up by physiology department, and the Department of Anatomy will take the other 2. So under module 1.1, we have the theme called, what does it mean to be a doctor? You had an overview of the whole AETCOM curriculum in your foundation course as well, so I'm not going into detail of what an AETCOM is and all of that. We'll go directly into the point. So this was introduced by the NMC because we wanted to integrate professionalism into our field, okay? You don't have to write this down, don't take pictures, you will get the PDF if you want, okay, after the class. So it focuses on the development of a doctor beyond the clinical skills of a doctor. So you are very new here, you're still young adults, and over the next 5 years, 4 years, you're going to develop, your attitude is going to develop, your communication skills are going to develop, and we are sort of, this session is to guide you into how to develop that for every one of you. So we have a total of 8 hours that we need to complete under this session. Not today, but the total should be 8 hours. Today we will be taking 2 hours of it. So medical profession is very, very complex. It is very noble. So during my father's time probably, people used to say that doctors are gods, right? Then came doctors are next to God. And today, doctors are what? Criminals, luteras, murderers, and all of that, right? Why? Why has it become like that? Why has it deteriorated so much? Do you think it's only because of the society? Do you think it's only because of what they show in the media or in the movies? It's also because we also have a role to play in it. We have also worsened and we have widened the gap between the patient and the doctor. Now this is still though one of the most sought after professions worldwide. Do you know why everyone wants to be a doctor? Why does everyone want to be a doctor? In India, this is going to be an interactive class, so I can hear answers from any of you. Why do you think everybody wants to be a doctor, or all the parents want their children to be a doctor? What? I didn't get, sorry. Respect. Do you think doctors get respect today in today's? No. Okay. Thank you for the opinion. Next. Yes. Job security. Do you think doctors have job security now? We have recently heard that for 194 JR seats in Safdarjung Hospital, around 2,500 JRs applied for it. Why? Okay, next. Anybody? Why does everyone and their parents want their children to become a doctor? Anyone? For status maybe? For financial gain? Do you think doctors earn enough in this country? No. Okay, some of them are saying no. How many of you say, how many of you agree with the statement that doctors don't earn enough in the country? And the rest of you agree that we earn enough? Do you know why 2,500 people applied for a job of 194 seats? So I passed out from Safdarjung. I know that the hospital, Safdarjung Hospital, is the highest paying government hospital in the country. And the fact that so many people applied for it is because of the same thing, finances. So it is not that there are such, of course there is also limitation of the job field is also getting saturated, but it's also a fact that many people want to join Safdarjung Hospital in Delhi because of the pay that they are giving. So as a whole, you can see, although we call our profession as noble, we hardly get respect. We don't have financial security, we don't have job security, and on the top of that, we don't even have physical security, right? Profession, very, very complex. Therefore, in this kind of scenario, how are we supposed to behave? How are we supposed to live this life? How do we navigate that area is what we're going to discuss. But before we go into that, we have to understand our own identity. Who are we? That quality is developed from the day that you join this medical college. This development doesn't happen in one day. It takes time. And over the years, as you grow older and older, you will still be developing those skills to navigate this area. So let's go through it one by one. This is one of the questions that can come. What are the professional qualities of a physician? Every one of you is supposed to be professional, you understand that. So when I told you that you have to go, you can go for a break because you had a long class, most of you went for a break, some of you sat down on your own chairs, you didn't move, and some of you were loitering around in the class. Do you think that is professional? Anyone? No, that's not professional, right? Because your teacher is here, all of your seniors are here, and this is our professional dignity to sit down when our seniors are there, how we behave around them. Of course, when nobody is there, you can go back and forth, that's okay. That's one example of it. So let's go through one by one. Moral intellect practices with responsibility and accountability. We have to be able to combine our moral values and our intellect values in our practice. Sometimes moral values collide with intellect values. Sometimes we have too much of morality and no intellect. Sometimes we have intellect and no morality. These things should go together. Responsibility and accountability. Everybody likes to take credit, but nobody likes to take blame. We are, as medical professionals, we will make mistakes, and we should be professional enough to accept it and take accountability and change ourselves, improve ourselves. That is expected of a professional physician. Next, we have ethical and legal codes of conduct. So every physician or every developing physician is supposed to know the legal code of conduct of the country, of their particular institution or the area. It may vary from place to place, but you're supposed to know that, you're supposed to practice it. You're supposed to practice the principle of informed consent, which is usually not practiced in India. Before you even touch a patient, you're supposed to inform them. The consent should be informed, which means you have to tell the patient that I'm going to do this, do you give me the consent of it? Usually in India, we just do everything, just like that. Patient has no say in it. We just do whatever we want, whatever is required for the patient. We don't inform them. Or just before the operation, while the patient party is running and you give them a piece of paper to sign. That is not an informed consent. You're supposed to counsel them, which is lacking in the country. Confidentiality of the patient has to be maintained, right? Do not discuss the particulars of the patient. I think this has been taught before also. We are not supposed to discuss whatever, we discuss the disease. We are not supposed to discuss the, whatever the patient, about that patient, okay, with here and there. Patient has the right to that privacy. Think of yourself if you are the patient and if your doctor goes on telling about your case to everybody. right? Adequate knowledge about the medico-legal, societal, ethical, humanitarian principles influencing healthcare. Ethical. I'll tell you one example in my own experience. There was a case of a minor. She was around 14 maybe, many years ago. So she comes from a very humble family, very poor family, and her father was giving her hand in marriage to a man who was much older than her, because the man had a job. So the girl was in love with another boy. So let's say the boy's age was another minor, 16 years of age. So when the father was forcing the girl, she ran away. She ran away with the boy and got married in the temple. Although the marriage is invalid, the father then came to know about this and charged the boy with a case of kidnapping and rape. So obviously became a medico-legal case. So what happened after that? Father came back, brought the daughter. They were caught by the police. They brought the daughter home. But before they could actually bring the daughter home, they had to check her, right? So they brought her to the hospital for counseling. Since the father also said that the girl has been raped, so that had to be proven medically. So the gynec checked her, and they found out that she had perforated hymen, which is a sign of sexual activity, recent sexual activity. And the gynec, to my shock, started scolding the patient, who was a minor. Why do you have to run away from home and lose your character? Do you think that is professional? Do you think that it does not breach the ethical code of conduct? It breaches the ethical code of conduct. So that gynec, although he had his own expertise, he did not have professionalism. His morality, though, took off, right? Based on his sense of morality, he started scolding the patient, shaming the patient in front of all the medical staff. Though she was only a minor, what happened after that, I do not know about the case. But these are the cases that are happening in many hospitals. A doctor is not God. Doctor is not next to God. Patient is not your servant. We are service givers, and we are supposed to be professional, ethical, while we do that. All right? See, the girl was a minor. She didn't know what was happening. And she was immature, right? She couldn't even complain. She probably didn't complain about the doctor. Had it been that she complained, there would be legal case against the doctor. This is just an example that I'm giving, that the life of a doctor can be quite complicated. Practices pertaining to specialization. So this says that this is expected of a doctor, that you will take care of your own specialization. So if you're a gynec, you would not be providing, let's say, see, they are interrelated, but you're not supposed to be providing pharmacological advice to the patient, all right? So let's say a good example of it would be an MBBS doctor doing the job of a gynec in a peripheral hospital. So let's say MTP, medical termination of pregnancy beyond 24 weeks. That can be done by only a gynec with the permission of the magistrate. And in many cases, doctors in the periphery, for a lump sum amount of money that the patient gives them, they are doing these practices. This is illegal, and it is not expected of a physician. Then we have personal attributes. See, beyond being a physician, doctor, when you become a doctor, when you get that degree, when you become a doctor, or when you're starting to become a doctor, you're studying to become a doctor, you're expected to do things beyond the hospital, the values that goes beyond your hospital duty. Even when you're outside, you're supposed to have those characters. For example, kindness, compassionate, accommodative, humanistic, honest, better listener. You will see when you start practicing that there are many patients, and when you have your hospital visits also, you will see there are many patients who would come to have a listening ear. Nobody listens to them at home. They come to you and they'll tell you so many stories. You're supposed to be a compassionate listener. You're supposed to look at a patient beyond a vessel carrying a disease. because it really helps them. There are studies that have been done that proves that if the doctor-patient relationship is good, the person's recovery can be cut into half. Growth of the medical profession, always growing, always ready to learn, always updating yourself with everything that is possible to be better in your profession. Adequate knowledge of disease and healthcare delivery. So every day there is a new disease coming up. I think during COVID also we have suffered enough. We have learned the hard way that we don't have enough knowledge about the disease, COVID-19. So there are many diseases like that upcoming. There are many technology now available. Many medicines are now available to treat diseases. Even the presentation of the disease can vary from people to people. Always updating yourself is what is expected. Another quality is to participate in national and regional healthcare programs. How many of you can name any healthcare program of Tripura? Let's say national healthcare program. Anything that rings your bell? See, none of us are aware of it, right? But we are supposed to know. We are not only supposed to know about the healthcare programs that are available in the country, we are also supposed to participate in it. All right, that will really help you be more compassionate when you understand the plight of the people, plight of the patients that you deal with every day. Communication skills. Obviously, communication skills. See, sometimes we have discussed it in panel discussion also. So many of us as doctors, we use so many medical terms. It's very difficult to explain it to the patient. How do you explain a case of metastasis of cancer to a patient? How do you make a patient or the patient party understand a neurological case? To be able to speak in layman terms itself needs skills, always developing that communication skills. That will not come in one day. That takes years to come. But if we don't have this in our head that we have to be better communicator, we will never learn. So it can also start with learning the basic language of the place that you're studying in. So if you're here, please try to understand and learn the local language here. Practices with caution and care. Now, caution and care, for example, make a list of everything that you're doing and enter everything on a register, because this will save not only your patient but also yourself from medico-legal problems. You're supposed to, you're not supposed, if you're a male doctor, you're not supposed to check a female doctor alone. You're always supposed to, if you're checking a female patient, you're supposed to call the patient party either, or you're supposed to, if there is no patient attendant, you can call one of your female staff of the hospital as a witness. That will save you, and it will save the sanity of the patient as well. Professional conduct, don't have to say much about it. Avoids publicity. Yeah, there was, have you seen med influencers? Yeah? So recently, I do not know her name, there was some medical influencer girl on Instagram, and she had been making, from my understanding, videos from the time she was an intern, and she was acting like she was the specialist in several fields, and she had made many videos that went viral. She had also given a lot of wrong information, not because she wanted to, but because she was not having adequate knowledge on that field. But because she wanted fame, she did that, and she received a lot of backlash. She had to delete some of the videos. So we all want fame, right? We all want to be popular. But that can also be done. We want to give knowledge also to the public, yes, to bridge the gap between patient's knowledge, public knowledge, and the medical knowledge. But that can be done without publicity as well. So if you ever want to open an account on Instagram as an influencer, please don't publicize yourself so much. You would see many doctors out there on the Instagram who would just sponsor anything and everything for a little amount of money. Relevant referrals. So when you are giving referral to the patient regarding any test, or even referring the patient to another hospital, it should be relevant, not based on the fact that you're not able to treat the patient yourself. Okay? Whatever is the best for the patient, you're supposed to do that. Knowledge and skills, ever growing, ever developing, should be able to treat the patient at the PhD level itself. So the referrals will go lower. And finally, altruism. What is altruism? It is selflessness. The doctor is supposed to ensure patient's interest over self, especially their wishes in reference to preferred line of management. This is rarely done in India. So if you see any European country, what they usually do is they ask for patients' preferred treatment. In case if it's not an emergency, you will see a person coming for delivery or during the checkup, antenatal checkup, they'll ask them what is their preferred line of treatment. Do you want to have medication? Do you want to undergo unmedicated birth? Do you want to have home delivery with the help of medical professionals there? In case something happens, what is your wish? All of that thing is done, keeping in line the wishes of the patient. But here, the doctor decides for the patient, and the patient cannot say yes or no to it, okay? That should not be. Any error by omission or commission as part of altruism must be disclosed to patient, which means that in case you make any error, you're supposed to disclose it to the patient. You're not supposed to keep it to yourself, but this is hardly done. And medical hospital authorities as a noble practice methodology which otherwise is not usually done. Now this is the session that I'm taking. It ends here. Now it's the time for group activity. Everybody loves drama, right? I love your skits, so I have inculcated this here. We'll have group activity. All of you will be divided into 6 groups. I know many of you are tired and sleepy, that's why. So please pay attention. You will be divided into group 1, 2, 3, 4, 5, 6. So I'm just explaining to you what it all means. You will be given a scenario, you have to act it out, okay? Give subtle acting where you would put both good and bad qualities of a doctor. So you are working at a community health center. When you observe a patient is leaving against medical advice, which is called LAMA, so patient is poor, you tell the patient, why are you leaving this hospital without my permission? I have admitted you. And the patient says that, well, I don't have any money. All my money has been spent on the medications already. I am not well. Even now, I don't want to stay in this hospital anymore. What do? That's your first scenario, okay? And mind you, these are all the scenarios from real life. Next, you're an intern, first day of internship. All right, you can take pictures of it also, no problem. You're an intern. You want to take the picture of the first slide? Okay. So you're an intern, doing your internship. This is your first day of internship. You have no practical knowledge about any patient. Please keep quiet. You are in the Department of Obstetrics and Gynecology. What happens now? You have to work for 24 hours. Okay, so you have come to the duty and there's a lot of rush in the labor room. You're in the labor room. You see that you have a patient. You have to help her have delivery. But you have no experience in delivery, you just know theoretical knowledge of it. Your seniors are busy taking care of other critical patients, you're alone. What do? What is the next step? Okay. For group number 3, you are a PG resident in internal medicine. So a patient is there who has fever for 1 month. He has tried all kinds of medication, he has tried every doctor possible, but no help. He has high fever that doesn't go down with any medication. The patient is a young boy, and you have to do a lumbar puncture. So lumbar puncture is where you put a big needle on the back, on the spinal cord to draw CSF, cerebrospinal fluid, which is an invasive method. It is very painful, especially on a person who's already very sick, okay? So this is the context. So you're doing that, you're supposed to do that, you did that, but you're trying to draw the spinal fluid, it's not coming out. You have done 3 times, patient is already crying by now. Patient is saying, please stop. Then what do? You have to take a CSF. So you tell your senior, please, sir, please come and help me out. So your senior goes so angry and says, for this stupid thing you have called me, you don't know how to take out even a simple spinal fluid, CSF fluid from the spinal tap. You can't do a simple spinal tap. And then he tries it himself and he fails as well. Now this is a situation that could have been dealt with in a better way, right? What could have been the better way to deal with it? Now patient, because the senior had scolded the patient, scolded you in front of everyone, including the patient and the patient party and the whole hospital staff. The fourth scenario, you are a PhD doctor, you are very well respected, you love your work, but you are not happy with the finances that you have. Okay, your income, your salary is very less. Then one MR comes to you, a medical representative comes to you saying that if you give my medicine, I'll give you a lot of money. And that money is a huge amount, and it can help you out with your family income as well. So what do you do in this case? Scenario 5, you are at a PHC again in a very poor neighborhood. So people there are very poor, they are hence anemic, and many of them are so severely anemic that they require blood transfusion. But your hospital doesn't have a blood bank, okay? So you have to collect your patients have to collect blood from the blood banks that are there at the tertiary hospital, which is very far away. So you have seen this in your hospital that some of the staff from your own hospital, they take money from your patients, okay, extra money, and then they bring the blood from other hospitals to the patient for treatment. But you have also realized that this requires a license which has expired already. Now you know the situation, you know that your seniors also know the situation, you are the junior there, but they are not ready to take any action. What would you do? Because one way, if you stop this, the patients will not get their blood and the patients will die. The last scenario, you're in a private hospital, your patient comes to you saying that she has pain in abdomen for past 1 month. She says, then you diagnose the patient with peptic ulcer disease. And standard treatment, one of the standard treatment is to give PPIs, proton pump inhibitors, or the so-called gas medicine. So you prescribe that to the patient for 1 month. But the husband who's there with the patient refuses it, starts shouting at you, saying that you people give this kind of medicine, and the patients, they lose their kidney. And you guys, this way, you people also are involved in organ trafficking. Okay, starts shouting at you, is insulting you, and is not ready to comply. How do you deal with this situation? So this is the context. Now you will be divided into 6 groups, and each one of those groups you have taken pictures of all of these. So group 1 will be you will be given 10 to 15 minutes to prepare for it and 5 minutes to do the skit. All right, this is for today.